I thought maybe I'm making some of these symptoms up in my head, and
Yeah.
they got everything. By the time I woke up at like 3 a.m. My brother woke me up, and then I felt like my thighs hurt, and I felt numbness, and I started freaking out, and
Mhm.
I went back to sleep, and then when I woke up, I felt completely normal. So I didn't know if it was like that I just had anxiety or what. But yeah, most people say that the symptoms go away within a few hours. And so,
Okay. Now, if anyone is experiencing those symptoms, maybe like for prolonged, like a few days, you would just recommend maybe just going to get tested just as a precaution. I know you kind of touched on that a little earlier, just to make sure, because as you just kind of like gave a range of,
yeah,
how long these symptoms may persist. So if longer than that, then maybe just, going to go get
yeah.
checked out just to make sure.
For sure.
Yeah.
Longer than that, it might not be the vaccine. It might be COVID or the flu or something else, something you
Yeah.
ate or something else or maybe allergies. It really
Yeah.
varies a lot. But yeah, if the symptoms are lasting, way too long, or of course, if you have any concerning, symptoms like chest pain or you can't breathe, talk to your doctor and seek care for that.
Right.
For sure.
Right. And the last thing I wanted to touch on is any natural remedies that you know of. I know that a lot of people, if they're not going to go get vaccinated or whatever, and they're wanting to take a holistic approach to this. See, I know that someone mentioned before, like I'm trying to think of it now and see.
The black seed?
The black seed, yeah, I think that's what it is. Um,
Yeah, so there was a randomized control trial, right?
okay.
And basically a randomized control trial means you put some people in the group that get the intervention that you want, and then other people who don't get that intervention, and you study the outcome in
Mhm.
both of those. So on one of them, they did honey and black seed oil,
Mhm.
where they gave, a formulation for the patients to drink, and then they compared, the outcomes. And so the conclusion was that the people who received the honey and the black seed oil had better outcomes. They were able to leave the hospital, had less like severe COVID-19 complications, and so therefore this intervention was good.
Mhm.
Um, I think with that though, it wasn't a good randomized control trial because the people who tasted it, they could taste the honey. They knew
Mm.
that they were the ones that were getting the intervention. And
Mm.
so, it's very important in science. We see placebo effect.
Mhm.
Placebo effect is very, very real. I mean, if you really believe in something, you can manifest that,
Okay.
you can really manifest it if you strongly believe in something. And we see that effect in various medications. And so the whole placebo effect is real. And
Okay.
we always have to think about that. I don't know if the placebo effect was really, I'm not saying to take away, but I'm just saying that for you to really say that this helps, you have to show that over and over again. And you have to, like, for example, in that study, I didn't, it didn't mention what other medications they were getting, like what if the people that got the black seed oil, maybe they were getting, anticoagulation, from their doctor, or they were
Mhm.
getting steroids. It's important to know those differences because those differences could have contributed to the total outcomes. But in regards to my natural, remedies that I would recommend to patients, I would just tell them whether it's 2018, 2019, or now 2021, I would tell them the same thing, like, hey, make sure that you're, eating healthy, lots of fruits, lots of vegetables, work out, keep your stress levels down, wash your hands. I don't think that it's important to go out and buy supplements that we don't know. There isn't enough good data to say this prevents COVID-19 infection or this doesn't. I feel like as long as you eat your smoothies and your vegetables and you're taking good care of yourself, that is really, what we can do and what I would recommend, because we don't have enough evidence of, like, if these things will increase your immune system, and
definitely,
and if even increasing your immune system is desirable in this situation.
Right.
Because a lot of the bad cases we've seen is because your immune system is too activated, and it kind of, decreases.
That's interesting. So you said it would decrease it, yeah.
Yeah, we don't know. I mean, I think for sure the overall status that you have is good, but I feel like that's something that, to have good health and to maintain it, is something that, has to be worked for months. Like, just taking a supplement for a week or two, I mean, that doesn't, that it takes months and months of good eating and taking care of yourself to be at a health status that,
a lifestyle.
Your body. Exactly. I mean, I don't recommend it, even for, like, the common flu. Like, a lot of times people will take zinc or people will take vitamin C, and there really isn't good evidence to say doing this will decrease the amount of time that you will be sick from it. It's more of, like, making sure that you're getting a right amount of vitamin C daily, so that your immune system has, months of being on these supplements, that it's healthy and it's strong and it's thriving. If you haven't been eating right, and then have the common cold, you can't just like take a whole bunch of, like, vitamin C and zinc and expect your immune system to kind of be ready and to fight just within those few days of those supplementations. Like, it takes time.
Yeah, it's kind of like if you are going up against, like, if you're in a competition, you're going up against someone who has been a bodybuilder for, their whole life, and then you spend 6 months doing that, and if you go up against this person who's been doing that their whole life, chances are your chances are going to be slimmer than theirs at winning anything.
For sure.
Definitely.
Yeah, it's not to say, I mean, it's not to say that, like, we don't want strong immune systems for COVID. We definitely do. I don't know enough to say, we should be taking all of these supplements, because what if later on we find out those supplements actually are linked to worse outcomes? So a lot of times we recommend things because they feel good to say it, they feel good to hear it, but it doesn't necessarily mean that with time that will be actually true. Again, the biggest testament of truth is time. Time tests science. Time tests everything.
Right.
So it's just important to focus on long-term health maintenance.
Definitely. I agree. Well, thank you so much. I appreciate you being on this episode with me and just being so thorough on your responses and just taking the time out to, inform others so that they do. And the basis of me wanting to do this as a lot of you may heard in my previous episode, was to just make sure everyone is making an informed decision, whether your stance is to receive vaccination or, not receive vaccination. Don't make that decision, without the proper information, and to stop the myths and the rumors that are spreading, because, I know just, it's a societal norm for that to happen, but with something so serious that could affect others in a different way than it can affect you, I just feel like people should, be more careful and just have an informed decision and the proper information. So I definitely appreciate you being here for that. Thank you so much. Is there anything else that that you wanted to, leave off or say or just state or anything? Or I know we covered a lot.
Yeah. No, thank you so much for having me on the show. You asked really great questions.
Thank you.
I post some COVID-19 videos, like myth busting or just general COVID-19 information on my YouTube channel as well as on my Instagram. So
okay, and
my
what's
Instagram handle is dr.ecsisv. So dr.ecsv on Instagram, and that's where I'm most active. But I've also posted videos on YouTube, and so you can find my YouTube channel also through my Instagram. But my last words would be, it's on one of the videos. So if you search for my IGTV videos on YouTube, they'll also be on their full length.
Nice.
But what I wanted to say, I guess my last statements would be, just keep wearing your mask, whether you're vaccinated or not. And I would say that the biggest reason to continue wearing your mask is because it's kind of the message that we are giving out to the public. There's no way to be able to know who's vaccinated or who's not at this point until we get again to that. I would personally feel more comfortable if it was, 60%, wherein the states would be like, okay, like maybe we can become more relaxed with the mask mandate. But I think for now, it's important to honor what families went through over the last year. They lost family members. They became very sick, and they're still dealing with the COVID long-term health complications. And so I think a mask at this time, to stop wearing it is very early on, especially when we don't know if the downtrend of the infections will continue to downtrend. Mm-hmm. And, we don't have enough of the population that's vaccinated at this time. So I think if you're not vaccinated, keep wearing your mask. It protects you from, having virus on your, spit or splattered on your face. Mm-hmm. And the humidity also, some scientists say that the humidity in your nose and inside, your throat, that humidity actually theoretically prevents the virus from entering. That environment is not what the virus likes. And so that's important to protect yourself and to protect others. And then if you're vaccinated, like fully vaccinated, I think out of respect, it's important for you to be mindful that other people are not vaccinated. Mm-hmm. And that we give a public health message, to everybody when everybody works together, wears their mask, is respectful of other people's vaccination status and health, like comorbidity status. And, it's just, to me, it kind of honors what we went through, the lives that we lost, and that we're still in a teamwork effort to get to a place where everybody is safe. And so, mm-hmm. wear your mask, not just for what the science is saying, but